Our theme this year is Master of Teaching, Art of Leadership. As you well know, we live in unusual times, and the COVID-19 pandemic has made even more apparent just how important teaching and leadership are during such times. Due to the pandemic, this year's summit is being held virtually for the first time ever. Although we are not meeting in person, we can still come together. I hope you will take advantage of all that this virtual summit has to offer, including the ability to earn more continuing education units than ever before, the chance to meet each other through our 3D networking room, and the ability to learn, about some wonderful products and services in the virtual exhibit hall. Today, we join together once again to celebrate the vital role of nurse educators and the impact we all make on the profession and in all countries around the world. This is also a time for NLN to recognize and honor nurses and all healthcare professionals in our community of colleagues who each day step up to help others, often spending time away from their homes and families in service of the common good. Thank you so much for your work. In addition, I would ask you to join me in a moment of silence to recognize those nurses and others who lost their lives in caring for people with COVID-19 or who contracted the virus, as well as those who lost their properties, their livelihoods, and or their lives in the hurricanes, floods, and the West Coast wildfires. A moment of silence, please. Thank you. Next, allow me to acknowledge the members of the NLN Board of Governors. You have no idea how valuable their insights and wisdom have been. I'm so thankful for my colleagues, beginning with President-elect Kathleen Poindexter, Secretary Cheryl Killian, Treasurer Ann Krause, and the Board of Governors, Mark Hann, John Lundeen, Anne Marie Morrow, Angela McNeilis, Linda Moneyham, Michael Newsom, Mark Vogt, and Lynette Wolford. Thank you all. If you were with us last year, you know I invited the Board of Governors to join me in sharing what the NLN core values of diversity, integrity, caring, and excellence meant to us. This year, I invited the board members to join in sharing what the mission statement means. And I'm pleased to tell you this information is available in the September-October 2020 issue of Nursing Education Perspectives. And that is what we told Bev we were doing this year. Unbeknownst to her, however, we secretly chose this opportunity to share with our membership how important she is as having her as our CEO with such stature at the helm of the organization, especially during the trying times we have experienced. Actually, we decided to create this deviation as we shared with her our thoughts during her evaluation in January 2020. I emphasize that because that's a long time to keep a secret. During that time, she said, "These are things that typically are said only at someone's funeral." That statement haunted me because it often is so true. And in this case, the board knows the value that Bev brings, but we thought perhaps the membership might not. Thus, today, we, the members of your existing Board of Governors, are sharing with you some quick insights about how we value the leadership of Dr. Beverly Malone, our CEO. Bev, you have the ability to help us learn through the poignant stories you tell. You keep us real every day and committed to the greater good.
Bev, you exemplify the core values of the NLN through your authentic expression of caring, commitment towards excellence, persistent dedication to diversity, and servant leadership with integrity. You are the heart of the NLN. Leading with purpose, power, and passion, you inspire others to envision what can be and empower them to take action in the advancement of quality healthcare for all.
Dr. Beverly Malone, Bev, you are a phenomenal woman and extraordinary leader. I respect and commend you for consistently leading with boldness and honor through grit and with grace. Because of your authenticity, diligence, and dignity, we are assured that our organization will always do the right thing as it serves as a catalyst for growth and positive change. You had conveyed so many lessons about humanity simply by the way you administrate. Thank you so much for being an outstanding role model.
Great leaders inspire others to lead. Bev, I learn from and am inspired by your leadership every day.
Many qualities set the NLN apart from other organizations, but one that gives me great pride is the way you, Beverly Malone, bring your leadership, passion, and dedication to all at the NLN. I have always admired your compassion and creativity that makes what the NLN is. I am forever grateful for your selfless dedication to the NLN.
Bev, I have always admired your ability to command a room, yet never make others in it feel inferior or unwelcomed. Your trademark smile and nod of the head with your closed eyes instantly puts anyone in your presence at ease, with an understanding that you have a desire to not only hear, but truly listen and care. While we often put great leaders on pedestals, you have always been one to reach out and show us how we can get our own pedestal. Knowing and working with you has been one of my greatest pleasures.
Bev, you are a visionary, innovative, daring, and caring leader who is generous with your time and your talents. Your boundless energy and far-reaching impact in nursing and healthcare inspires us all.
Bev, your passion, intelligence, and grace lead us during times of opportunity, change, uncertainty, and difficulty. I am grateful for your dedication to nursing and humanity.
Bev, you are an icon of nursing leadership whose realm of influence extends well beyond the discipline of nursing. You lead the NLN in affirming its commitment to excellence in nursing education and in advancing the science of nursing education, while establishing processes for nurse educators to be certified and for schools of nursing to be designated as centers of excellence. Your creation of partnerships has produced cutting-edge resources for advancing nursing education. I am so privileged to have the honor of working with you.
Bev, it's been an honor to serve with you from day one. Your presence has been transformative to the NLN and to me personally. Thank you for all that you do.
Bev, you continually inspire a vision and provide a voice for nursing education. You represent the NLN and nursing with true professionalism and poise. Thank you.
Your example is one that inspires and motivates so many to conquer new territories. Your legacy is one that uplifts and encourages, so clearly demonstrative that the impossible is indeed possible. We are grateful to have a leader like you, someone in whom we place great honor and respect today and always.
As you can see, we think highly of this person who's provided the leadership and direction of the NLN for the last 10 years. for 13 years. Her contract's been for 10 years, which we will celebrate on next Monday. Last month, the National Center for Healthcare Leadership announced the selection of Dr. Malone as the recipient of the Gail L. Warden Leadership Excellence Award. Next month, Dr. Malone will be designated a living legend by the American Academy of Nursing. These distinctions, among the many she has received, are built on her entire career, which includes the NLN. The Board of Governors, Bev, is honored to present to you, Dr. Beverly Malone, the NLN Board of Governors Distinction Award. You should have a package of, there you go. You've opened it. Congratulations. Bev, did you want to say something? You are
I am hardly ever surprised, but I am truly surprised. I didn't open this. My mother, who lives with me, opened it and just gave it to me a few minutes ago. So I am, as my colleague Ariel would say, gobsmacked. It's totally a British thing, but I am overwhelmed, and I don't see how you guys could do it so well and keep it from me. I just don't, you know, we had rehearsals, and this was never, ever part of any rehearsal I was part of. So I am humbled. I'm honored to be a part of this organization. I mean, the NLN is such an important organization and has such history to it. And all we have to do is carry the history forward. I'm totally delighted, colleagues, grateful to work with a board like this, to work with a president like Pat, and to be here at the same time that so many giants in nursing are shouting out the truth. I am overwhelmed, and I thank you all.
You're so welcome, Bev. And I do have to say that trying to keep two scripts straight was the challenge. I had the word real and fake in big caps so that I didn't give away the secret. And I would like to thank all of the NLN staff who helped make all of this possible, because there were several involved in being sneaky behind your back, but for a good cause. Again, congratulations on such a well-deserved honor. I'm now going to turn it back over to you, Bev, to acknowledge some of our cherished supporters who are making this virtual summit possible this year. Bev?
Colleagues, thank you so very much to this year's sponsors. That's who I get a chance to say congratulations to. We first thank Chamberlain University for being our platinum partner for this year's summit. Thank you, thank you, thank you, Chamberlain. Laerdal and Western Governors University are also supporting us as platinum sponsors. Our gold sponsors are Duquesne University, School of Nursing, and Walters Kluwer. Our silver sponsors are Galen College of Nursing, Sentinel University, and Walden University. And our bronze sponsors are Charles R. Drew University of Medicine and Science, F.A. Davis Company, IntelliSTEM Writer, Jones and Bartlett, Pearson, Trod Jacks Sys, and newworld.com. Thank you all to all of our support of the annual summit and of the NLN. Finally, on behalf of the NLN Foundation for Nursing Education and Chair Cole Edmondson, we extend our hearty thanks to all who have contributed to the foundation throughout the years, such as the NLN Foundation Advisory Council, and that includes Karen Cox, Robbie Craven, Jennifer Huff, Richard Jordan, Nick Mansour, James Quick, Joan Rich, Paxton Ritter, Don Schuck, Sebastian Vos, Mark Vogt, and one member who has chosen to remain anonymous. Not to mention the 2020 NLN Academy class and the 2020 NLN Centers of Excellence and all benefactors of the NLN Foundations. Summit, thank you all. Pat, I'm turning it back over to you, and you are sneaky. That's quite a sneak attack.
But only for good causes. I would also like to thank the many people who give their time and talent to support the goals and missions of the NLN. What a group effort. You are all fantastic. Now, once again this year, we have 2 NLN President's Award winners. The NLN President's Award recognizes leaders in healthcare who are shining examples of the NLN core values of diversity, integrity, caring, and excellence, which we spoke about earlier. These individuals have dedicated their life's work to advancing the health of the nation and of the global community. It gives me enormous pleasure to introduce our first recipients, Bonnie and Mark Barnes, the husband and wife founders of the Daisy Foundation. Bonnie and Mark Barnes' creation of the Daisy Foundation was born of a personal tragedy, the death of Mark's son, Patrick. He died at age 33 from an autoimmune disease. Determined not to let their loss be in vain, the retired marketing and advertising executives set out to honor the nursing professionals who had provided such compassionate care to Patrick, and to do the same for nurses everywhere who are there for patients and families experiencing an autoimmune disease. The foundation's first initiative was the DAISY, an acronym for Diseases Attacking the Immune System, Award for Extraordinary Nurses. Today, more than 20 years later, under the couple's leadership, the DAISY Award is celebrated in more than 4,500 healthcare facilities and colleges of nursing in all 50 states, plus 28 countries abroad. More than 144,000 nurses nominated by their patients, the patient families and colleagues, have been award recipients. Each nomination, now well over 1.8 million nurses, tells the story of extraordinary nursing compassion and care. The DAISY Award has become a respected platform for healthcare leaders to showcase role models in nursing that reflect the mission and values of their institution. Thus, the DAISY Award program seeds positive change in organizational culture and behavior, motivates compassionate care, fosters teamwork, enhances nurse engagement to offset burnout, and promotes the public image of nursing. The Barneses have also developed 2 widely recognized corollary award programs to specifically highlight the importance of nursing education to the preparation of a compassionate nursing workforce. Those 2 awards are the DAISY Award for Extraordinary Nursing Faculty. It honors the inspiration and influence that faculty exert on their students. And the DAISY Award for Extraordinary Nursing Students is awarded during the student's clinical experience to emphasize that human connections with patients are key to compassionate nursing.
We are honored beyond words by this tremendous recognition of Daisy's work. Pat, Beverly, and all of you at NLN, thank you. Your support for our work is such an important part of our Daisy story, a story we never envisioned would still be being told over 20 years after it began. When our Patrick died, we had just one question. How in the world would we fill the gaping hole in our hearts his death had left? The answer was simple. We would fill that gaping hole with our gratitude to nurses for the compassionate care they provide every day. It was nurses who cared for our Patrick and nurses who got us through those 8 worst weeks of our lives when he was in the hospital. Today, we say thank you to nurses and to you the dedicated faculty and educators who inspire them, and are role models for the nurses they will become.
I would just like to add that we have so much respect and admiration for all of you, and that this honor is as much yours, if not more so yours, than it is ours. Thank you so very, very much.
We're so pleased that Bonnie and Mark received this award. Our second President's Award winner is the distinguished nurse, Dr. Joyce Fitzpatrick, who earlier this year retired after more than 20 years as editor of Nursing Education Perspectives. At the time of her retirement in January, Dr. Fitzpatrick was lauded as one of nursing education's leading scholars and luminaries who occupied one of the most visible roles at the League. As editor, she cultivated and published research that elevated the status of NEP, making it a premier venue for scholarship in nursing education. Combining her twin passions for research and writing, she transformed NEP from a magazine limited in scope to issues of community health, service learning, and nurse-managed academic clinics to a serious, scholarly, investigative journal. In alignment with the League's mission, NEP is today dedicated exclusively to advancing the science of nursing education. With the landscape of research in nursing education expanding, Dr. Fitzpatrick became increasingly selective in soliciting manuscripts that reported on rigorous multi-site studies that focused attention on the NLN's core values. A prolific author herself, Dr. Fitzpatrick is widely published in nursing and healthcare literature with more than 400 publications, including more than 80 books to her credit. I mean, who among us hasn't read something that she has written? She remains the editor of the Journals of Applied Nursing Research and the Archives in Psychiatric Nursing.
Thank you, President Yoder-Wise, for this award. And thanks to the NLN Board of Governors, to Dr. Beverly Malone, and to the entire administrative staff of the NLN. But most especially, I want to acknowledge the Nursing Education Perspectives team for making this possible. The section editors, the editorial board members, the reviewers, and the authors, and most especially Leslie Block, managing editor. Leslie and I worked together for over 20 years to make Nursing Education Perspectives the top nursing education research journal, and I could not have done it without you, Leslie. Thank you.
On behalf of the NLN board and the entire NLN family, let me extend again congratulations to Bonnie and Mark and to Joyce. It is now my pleasure to introduce our keynote speaker, Rear Admiral Susan Orsega. Thank you to our special keynote sponsor, Laerdal, for making this session possible. As director of the Commission Corps headquarters, Rear Admiral Orsega is responsible for directing all functions regarding personnel, administration, operations, readiness, deployment, and policy for the approximate 6,500 members of the U.S. Public Health Service Commission Corps. She is the principal advisor to the Surgeon General on activities and policies related to Commission Corps training, preparedness, activation, deployment, and total force fitness. Rear Admiral Orsega served as the Chief Nurse Officer of the U.S. Public Health Service from May 2016 to March 2019. In this role, she advised the Office of the Surgeon General and the U.S. Department of Health and Human Services on the recruitment, assignment, deployment, retention, and career development of nurse professionals, and was responsible for providing leadership to 4,500 commissioned corps and civilian nurses. Today, Rear Admiral Orsega will speak with us about the role of the nurse in public health and the COVID-19 pandemic. Please join me in welcoming Rear Admiral Susan Orsega.
Good morning. It is absolutely a distinct privilege to be here with all of you today, and I certainly want to thank the organizers who've really put together a fruitful and meaningful meeting this week amongst the challenges, and specifically acknowledge the leadership of Dr. Malone and Dr. Yoder-Wise and the rest of the team. Before I talk to you today about COVID-19 and what you can do as nurse educators, I want to recognize you for your leadership and the importance of having this meeting. Your continued conversations and influence on addressing COVID pandemic and the health of the nation is paramount. And whether it's working in the clinics or the institutions or across the organizations, at the bedside or the boardroom or even at the blackboard, with impoverished to imprisoned or even in urban or rural settings, you are the scaffolding for many who just don't have access to good health and are seeking answers to this pandemic. We have to see ourselves in this light. I want to particularly acknowledge all of the nurses, the unsung heroes who've been on the front lines. COVID-19 has truly impacted all of us in everything in our lives, our health, our work, our play, and our relationships. And the one thing that COVID-19 has made abundantly clear is how small our planet is and interconnected we are, and how we need to work across the profession to address this complex public health crisis. So today I will share with you my perspectives on how I firmly believe we need to navigate through this complex time. And I believe it's our logic, our intellectual, and our leadership tools that will allow us to work across all the settings that we're in. And it's not just our stethoscope or our electronic programs and our iPhones or our books that we refer to, but it's our set of core leadership and fundamental characteristics that will allow us to turn that dial towards addressing this deadly disease. Next slide, please. Next slide. Today is a stark reminder of this deadly disease. In fact, when the slide deck was prepared, the numbers certainly have changed, and the COVID virus death tops 200,000 as we face the fall in terms of deaths, and it is a dismal milestone for the country. U.S. leads the world in the number of confirmed cases, and despite accounting for 4% of the global population, the U.S. has actually recorded about 20% of the world's coronavirus deaths. And we have to remain on guard as warriors, because the importance of flu shots can reduce the burden on the healthcare system as we're battling this new wave of COVID-19. Next slide. So the Spanish influenza from 1918, I think from my perspective, really gives us some remarkable lessons. And this pandemic was the first great collision between our environment and the modern day science at that time. Evidence suggests that it in fact was started in January of 2018 at the height of World War I in a small county, Haskell County, Kansas, where farming was abundant and they had vast rolling fields of grain. And interestingly, the same weeks that was unfolding in this county, several miles away, Army soldiers were presenting with reports of, quote, an influenza of severe type in the second largest Army training encampment. And it turns out what Haskell County was reporting was only a fraction of the death rate that the U.S. Would have later that year. In fact, it killed more people in 24 weeks than HIV/AIDS killed in 24 years. That same year, the United States Public Health Service at the time and Red Cross were collaborating to attempt to concentrate nurses and physicians and supplies in one community where it was most needed, and then would shift to the next community of greatest need. That should sound familiar, right? In fact, the two leaders of the U.S. and Red Cross divvied out and divided out the labor. So the United States Public Health Service would supply, pay, and assign all the physicians, where the Red Cross would do the same. In fact, they used one model across the country, Massachusetts model, and that was led by a man named James Jackson. And Red Cross made these gauze masks, and Jackson brought in the nurses from Northeast to areas impacted in that state. But strikingly, by October, everyone needed nurses, or they were about to, and they knew it. Physicians diagnosed at that quarantine, at the cot area, and then they moved on, leaving behind the nurses whose goal was to treat and provide supportive care to the impacted individuals in those quarantine areas. In fact, many nurses were at the times in charge of vast amounts of areas, as you can see on the screen. But what is interesting is before the Spanish influenza, there were a quarter fewer nurses in the profession to begin with. With the combat that was intensifying in France, there was a need in the Army to have more nurses. In fact, there were, as it was reported, 1,000 nurses were needed a week to be transported over France. And the Army School of Nursing was also underway of developing its first program. The Red Cross recruiter at the time wrote, "The work at the headquarters has never been so difficult, and it is now overwhelming us. We're searching for one end of the U.S. to the other to route out every possible nurse from her hiding place." Yeah, so the recruiter on that September 5th, 3 days, and that was reported 3 days before the virus exploded in Camp Devens, which was one of the largest encampment places in the United States. And, you know, public health, judgment, knowledge, observation were the tenets of the profession, caring for those ill in the cots. And with predictions at that time that then became reality, lessons like this should influence our approach to the way we do nursing, and it needs to stick this time. Next slide. So with COVID-19 in the United States and globally, you know, there are fundamental differences in how individuals and communities obtain care from the past. But the lessons of 1918 are the building blocks, in my view, for the tools we need in nursing to address today's pandemic. And I'm going to walk you through some of those leadership tools. So the first one is collaborations. So you may not always have all the tools in your organizations because of the limitations with funding or bandwidth, but you know you have tools within your professions and with others that you meet across who have shared goals. So as you can see in the upper screen, there's a picture of, in fact, the Javits Center, which, quite striking, is similar to the quarantine paradigm that was used in 1918. And when we got the word to mobilize nurses as well as other healthcare professionals to the Javits Center in New York, we knew that there was a great need to have nurses to have training for the use of ventilators. We didn't have the training available in our portfolio, but it was a phone call to Dr. Eileen Sullivan-Marks at NYU, asking her to help me strategize and help the Corps strategize on how we can get real-time training for the use of ventilators for the nurses before they were deployed to the Javits Center. We didn't have any training of that kind, but quickly her team at NYU mobilized and was able to work with us to have training available to the 30 nurses who were deployed to that center that was anticipating 1,000 patients. In the 80s, previous chief nurse, Dr. Faye Abdallah, she locked arms with Surgeon General Koop to address the stigma around HIV. And it was innovation and risk-taking of leaders like that in the yesterday's leaders that moved this country and communities forward to improving health of the nation. Those leaders were futuristic, they were multidisciplinary collaborators during a crisis, and we, quite frankly, we really need to do the same. Community engagement. So health equities certainly are efforts to ensure that all people have full and equal access to opportunities that enable them to lead those healthy lives. And you know, many we know don't have access to tools that influence health equity, and have access to the knowledge around COVID. But we also recognize that there are many community leaders that are, in my words, trust translators. And we need to have the similar roadmap to connect our strategies with our communities. And while nondescript, you know, working in communities is very influential. Bringing appropriately trained individuals to teach at that level of that community is paramount for COVID as we embark upon talking about the disease and talking about vaccination. And oftentimes, strategists think about the logistics and a crosswalk of how you're going to get that vaccine to the community, the logistic component, the needles, the supplies, but arguably that's just as important as who will get it and how it will be received from the optics in the community. Those trust translators, those community leaders, community stakeholders are critical to the community planning. And we learned this in Ebola, and certainly lessons have been shown with the work around HIV and AIDS. The same should be used for mass vaccination programs. Number 3 is cognizant of your surroundings. The world is connected more than ever. And we know distance is no longer a barrier from diseases or endemics. We knew that with Ebola, and we know that now. If you can take 2 countries far away from each other in the world, you can oftentimes connect them with one commercial flight or a ship that has passengers and workers with vastly different cultural backgrounds, but with one common risk, such as the epidemiology and the spread of the disease on the Diamond Princess ship and with COVID-19. We have to be poised to be responsive and keen observers in the practice of global health and public health here at home, and to be that detective. And disease really only requires a small opening to spread in this tightly connected world. Ebola is an example. We know with COVID, it certainly has shown us. You can't be prepared for every infectious disease or global health crisis, but in preparing for today's remarks, I actually reviewed some of my notes from some previous messages. And I remarked about we had to be one step ahead, and we have to continue our vigilance and advocacy and a culture of preparedness for that next Ebola. And striking, we are here. The 4th one is to capitalize on the momentum of the moment. You know, this is an optimal time to make a case for expanding your nursing programs and attracting more into the profession through a multitude of innovative branding tools, using media, or meeting with lawmakers to describe the need for full practice authorities. You know, there is and was a workforce shortage before COVID. It didn't stop. In fact, arguably, it may be even increasing given the current economic and workplace challenges in the universities, hospitals, and clinics across this country. And the last is shout from the mountaintop. You know, going forward, you know, the investments in establishing a presence are strategic. We are a national and a global asset, but we have to view ourselves in this regard, and it's incumbent upon us to raise our voices. We have a responsibility to address the health equities, inequities, and COVID, using that as our backdrop, but we have to pack that in our backpack strategically with the right tools. There will be continuously challenges ahead. You can certainly look at all of experiences and the past and access and mortality rates and chronic diseases, the challenges behind opioid. And you can also see with COVID geographically across all of the populations. So we have that backdrop with COVID, with the statistics and the disparities across the healthcare. We can certainly use that as a tool to drive where nursing can make the biggest impact. But we have to understand the relationship to where we're providing those services in the community and to be creative, because not everyone can take off in the middle of the day to get vaccinated for COVID. And while we wait for those scientific solutions, we should be in our professional think tanks devising and defining an implementation and a communication strategy to advance the profession. Next slide. So I'm going to shift a bit and tell you a little bit about the United States Public Health Service. We were established in 1789. We're led by the Assistant Secretary for Health, Admiral with the U.S. Surgeon General Adams, and we are 6,100 Commissioned Corps officers who meet the complex needs of underserved populations across the nation. 11 professional categories. We lead federal policies and programs focused on health and work in assignments that are often isolated or hard to fill. And in the fall, in fact, we'll be opening up applications to our Ready Reserve component. That is really a quite exciting moment for the Corps, for individuals to come in and apply to a Ready Reserve, much like a Ready Reserve on the other services. Next slide. The Public Health Service has had a rich history in connecting with communities, and our mission is to promote and protect and advance the health and safety of the nation. Certainly, pneumonia was a serious concern in the early decades of the 20th century, HIV, and then Ebola, and we continue to be on those front lines. Next slide. So our goal in public health services is to create a culture where the good health is in the reach, and we're there to rebuild communities in times of disaster and to reach those populations far away and hard to fill places. This has been the most historic deployment on record for the Corps, with more than half of the Corps deployed to support COVID. Many of our officers have deployed more than 2 times, and this really depicts a variety of different deployments that we've had, from meeting individuals coming from who were repatriated, coming back from areas in China or Japan, to responding to community-based testing sites, and also being there on the front lines, as I mentioned previously, in alternate care sites to be able to care for patients and individuals who were impacted by by COVID. And this has been certainly one of our backdrops, is our ability to deploy to numerous of catastrophic events over the course of the Public Health Service. Next slide. So in closing, I offer a few points for where we need to move in nursing, both in times of COVID and beyond. We need to think broadly about our capability, which is our capacity and our ability. And the capacity is our tools, and the technology and knowledge, and the ability is our talent and teamwork. And we all can be those public health nurse quarterbacks. And if not now, then when? And the world gets better when we choose to come together, and really the agents are us. All of our roles could not be more important in today's healthcare climate with COVID. And there's so much we can do, but we can only do it when we come together as a partnership, in a partnership. And just as influenza in the 1918 shaped our history in our profession, COVID-19 will be the story of science and discovery, and how one changes the way one thinks amidst crises, in the way nursing responded. And it has to be our turnkey moment for our profession. We must be that linchpin to address COVID-19 This will be the glide path for how our profession approaches future large-scale outbreaks and how we're viewed as leaders at the table, improving health in populations across the nation and across the world. Thank you.
Well, that was incredibly wonderful. Rear Admiral Orsega, you took us to our history and brought us all the way to the now and then even into the future. How proud all of us should be to be a nurse, to understand that we've been shaping history and that we're living right now in terms of shaping the future. I can't say enough about all the work that you and your team, I know it's collaboratively, but right now I just want to focus on the team and to please give our warmest regards to all that serve with you. You're making a huge difference.
Yes.
Not only in the United States, but around the world. Thank you. Wow. Colleagues, I also want to give a big thank you to President Patricia Yoder-Wise and to the Board of Governors. I want to say a big thank you, and to our colleague Kathleen Poindexter, who is our president-elect. This is already a very meaningful, wonderful opportunity to understand why nurses matter, why we make such a difference. And Rear Admiral Orsega, you pointed it out from the top to the bottom of why nurses not only made a difference yesterday, but make a difference today. And we'll need to understand why we will make a difference tomorrow. So I'm delighted and honored to be with you.
Thank you, Bev. It's an honor and privilege to be here.
Let's go on, colleagues, to our next on our schedule to make sure that we get everything listed. Next on our schedule, we have some open time. And I know you've been saying, well, when is the open time? Starting at 12:15 and for the virtual exhibit hall. And this is a new thing for us. And so we ask you to take a look at it, poster viewing. And I know how hard our colleagues work on those posters. And so please make sure you take a look at the poster viewing. It's always informative. And then you actually get a chance to network in the lounge. So please check all of that out. Then from 2 to actually 2:45 p.m. Eastern Standard Time for those in other places, you can access the first concurrent session, followed by the second concurrent session starting at 3. The day ends with another virtual exhibit and poster viewing and networking hour that'll go from 4 to 5. If you haven't already, please download the NLN Summit mobile app. Just search for NLN Summit in the Apple Store or Google Play. You can also stay up to date with the latest announcements and engage with other attendees through the social media feed. And you can enter our drawing to win one of the 3 Amazon gift cards by playing the app game. You are our community of colleagues, and we want you to have an excellent summit. Thank you again to Laerdal for your support of this event, and thank you to all for joining us. And these are all of our sponsors that you see on your screen now. What a wonderful collection of sponsors. We thank you, but we thank those who chose to come also to the NLN Summit. We know you are our colleagues and our friends, like I said, a community of colleagues, and we are so delighted to have you on board.